Okay.
So my patient is 2 days post-op, her lower leg amputation, and we're going to be working on range of motion and flexibility to prevent contracture for the first thing, and then gradually moving into strength exercising over the next couple of months. So the first stretch we're going to have her do is I'm going to have you flip over onto your stomach. And she's going to do a hip flexor stretch. We're going to do it passively. Pretend this portion of her leg isn't there. And it's going to hold and push down, so this works her quads and her hip flexors. We could have her doing this up against a table or kneeling, but it's not going to be as effective as if done passively by the clinician. She's going to do this 3 times and hold for a 20-second count. Flip over again. Her next stretch is going to be for her glutes. So we're going to do a figure 4. So she's going to bend her non-involved leg, take her involved leg, flip it over, and we're going to go up. Again, the clinician can help with this. It's not strictly necessary, as they can wrap their arms around that leg and pull it in themselves until they feel the stretch. You can also press on the knee to move the stretch over to glute med. And they would do the same thing, hold that 3 times, 20 seconds. Her quad stretch is going to be a little bit different. Once she's got her prosthetic, she can do a standing quad stretch. For now, you want to tuck your leg?
Yeah.
We're going to do a quad stretch kind of similar to this. Again, she doesn't have this lower portion of her leg, so that's what's happening there. And she's going to feel the stretch right up in here. The last thing we're going to do for stretching and mobilization is we're going to do some light joint moves. Kind of almost like you're doing a Lockman's, where you grab the upper portion of her stump and move it through a grade 1 and a grade 3 joint mobilizations for pain relief and getting the swelling out of the area. When she's moving on to strength at about the 3 to 4 week mark, all the way up until the 2 month mark, we're not trying not to move too fast, especially with keeping the wound healed, closed, and preventing as much pain as we can. We're going to do, the first thing we're going to have her do is quad sets. So she has a bolster under her knee, and she's going to activate her quads and push down on that bolster. And she's going to hold that for 10 seconds. She's going to do it twice. And relax. Then she's going to do hip hikes. Normally would have her short sitting. We'll sit here. And she's going to be working on her hip flexors. And she's going to lift this leg up into the air. Hold that. 5 seconds. Down. 10 times. 2 sets. Then we've got prone hip extension. You want to lay down, face down. Keeping her leg straight and activating her glutes. We're going to have her lift her leg up back into the air.
Oh.
That's good.
Okay.
You want to watch for a rock in the hips, so you want to keep them steady like this, and make sure her ASISs are both touching the ground. Relax. Last thing she's going to do is hip ends. So can you lay on this side? Scooch forward this way. This leg straight out. Hip ends work on your abductors, your glutes, and even your hip flexors. They're a really good hip exercise. So what you're going to do is basically make an M with your foot. I'm going to move you through the range of motion, and then you do it, okay? You're going to go up and over. 1, 2. See the M?
Mm-hmm.
And then have her do it herself. Ten times, 2 sets. And that's pretty much what we're going to be doing until she's comfortable in her prosthetic and can get onto weight bearing and ADLs. she then would move on to cardiovascular training and